Menstrual pain or dysmenorrhea is often experienced by some women, especially in reproductive age. Even the incidence of dysmenorrhea in the world is very large. Some women who feel unbearable pain during menstruation can affect daily activities. Dysmenorrhea is pain and cramps in the lower abdomen experienced by women before or during the menstrual cycle. This condition is classified as normal if it causes mild symptoms. However, in some cases, dysmenorrhea can cause discomfort to interfere with daily activities. But this condition is very common because of hormonal changes that trigger uterine contractions to shed its lining before or during menstruation. The main cause of dysmenorrhea is hormonal changes that trigger the uterus to contract to shed its lining. Based on the cause, dysmenorrhea can also be classified into two types. Primary dysmenorrhea is a condition that occurs due to changes in prostaglandin hormones, which are hormones produced by the lining of the uterus. These hormones can trigger the uterus to shed its lining through uterine contractions so that it can cause pain in the lower abdomen. Primary dysmenorrhea can come on at any time during menstruation, but it's not caused by any disease or other medical cause. Secondary dysmenorrhea is menstrual pain that can be triggered by problems in the reproductive organs. Endometriosis, pelvic inflammatory disease, uterine fibroids, adenomyosis, cervical stenosis, adhesions on the inside of the uterus. Secondary dysmenorrhea can cause pain that is more severe and longer than primary dysmenorrhea. In fact, in some cases, pain due to secondary dysmenorrhea is still felt even though the menstrual As for a number of factors that can increase a woman's risk of dysmenorrhea are as follows. Women under 30 years old. There is a family history of frequent menstrual pain. Getting your first menstrual cycle at a very young age, i.e. under 11 years old, early puberty, irregular menstrual cycle, excessive bleeding occurs during menstruation. The main symptom of dysmenorrhea is continuous pain in the lower abdomen that can occur before or during the menstrual cycle. The pain can spread to the waist, lower back, and thighs. In addition, a number of common symptoms of dysmenorrhea are as follows. Nausea that can be accompanied or without vomiting. Headache. Flatulence. Lethargic or not energetic. Basically, the doctor will do an examination to find out if dysmenorrhea is caused by certain medical conditions. A number of examination procedures involve to confirm the diagnosis of dysmenorrhea. Imaging examinations, such as ultrasound, CT scan, or MRI pelvis to see the condition of female reproductive organs such as the uterus, cervix, fallopian tubes, and ovaries of the patient. Hysteroscopy, which is an examination procedure by inserting a tube equipped by a camera through the vagina to check the condition in the uterus. If it causes mild symptoms, dysmenorrhea can be overcome by doing self-care at home, such as warm compresses the lower abdomen, do moderate exercise, such as yoga, walking, or Pilates. Take a warm bath. Get enough rest. Avoid alcohol consumption and smoking. However, if menstrual pain does not subside, it's good to consult a doctor to get the right medical action.